Hi, everybody. Thank you so much for joining us for our Google Hangout this afternoon. And we apologize for the delay in getting started, but we appreciate you being here and for participating in our special discussion this afternoon about binge eating disorder. And I am joined by these three lovely ladies who are here to share their expertise on this topic. Dr. Kimberly Dennis, Medical Director and CEO of Timberline Knolls Residential Center, Jessica Setnick, Senior Fellow at Remuda Ranch, and Dr. Dena Cabrera, who is a licensed clinical psychologist at Rosewood Centers for Eating Disorders. So welcome, ladies. We're so glad that you could take time out of your schedule to be here with us. We are going to be talking about binge eating disorder, which I think countless individuals struggle with across the world. And unfortunately, it's not as well known or discussed as anorexia or bulimia. And I think there's a lot of misunderstanding about binge eating disorder. And so we wanted to have this forum discussion to bring light to some of the issues that are commonly misunderstood and just hear from our experts about this important topic. So, Dr. Kim, we're going to get started with you. If you could just give us a little bit of an introduction about yourself and maybe what your experience is working with patients that have binge eating disorder.
Sure. Well, thank you so much for putting this on and also having me participate. I'm really happy to be here. I'm a board-certified psychiatrist, and I've been working with eating disorder patients for about 15 years now. Started at the University of Chicago with Daniel LaGrange, and for about the past decade, I've been working with patients who have binge eating disorder at Timberline Knolls, which is a residential treatment center for women. And my background is really in eating disorders as well as co-occurring substance use disorders and trauma. So we see quite a bit of that in women who have binge eating disorder as a medical illness.
Great. Thank you so much for sharing that. And your work in the eating disorder community is just so important and so invaluable, so we appreciate you being here with us today. Ms. Jessica Setnick, if you could also just give us a little introduction about yourself and just maybe share with us briefly about your work in the eating disorder community and maybe your experience with patients that have binge eating disorder.
Sure. So my first job out of school was at Children's Medical Center of Dallas, right when they decided to start their eating disorders program. Then I was in private practice for 13 years, and then for the past 11 months I've been with Remuda Ranch as a senior fellow. And what I've observed is that binge eating as a symptom can actually occur among any of the diagnoses. So as I'm sure the two speakers would agree, individuals with anorexia might experience binge eating, individuals with bulimia might experience binge eating, and then of course binge eating disorder on its own. What I have also observed is that for some reason binge eating disorder has often been a little bit of a stepchild to the other two eating disorders, and so I'm glad that it seems like things are changing and we're starting to recognize that regardless of specific diagnosis, anyone who's struggling with their eating needs and deserves help.
Thank you for sharing that. And Dr. Dena, to end with you, can you also just share with us a little bit about yourself and also your work in the eating disorder community?
Sure. I am the Executive Clinical Director at Rosewood, and I oversee, train, and supervise the clinical and dietary department as well at Rosewood, as well as at Rosewood, which is called A New Journey in Santa Monica, and Rosewood Tempe. So my experience really began working with anorexia and bulimia in the field of eating disorders for over the past 17 years, but as I concur with Jessica that throughout the years we've been seeing more of a population related to binge eating disorder. I think that has to do with the awareness and the diagnostic tools that we've had mostly in the last 5 years, and then particularly in the last year where with the DSM-5, binge eating disorder is finally being recognized as a diagnosis. So that comes from working with eating disorders for over 17 years and seeing and talking with patients about their struggles, that though they may seem to present like bulimia or anorexia, they have this binge eating quality to them, and now we're actually seeing it separate from anorexia and bulimia in its own category and its own diagnosis. So it's really been nice because there's a lot more patients with binge eating disorder suffering. The prevalence is higher, and I think it's significantly underdiagnosed.
Mm-hmm. Definitely, and we just so appreciate the contributions that the three of you have been making in our community. And you know, as we start talking about this topic, we just appreciate the experiences that you've had and that you're coming here and sharing more awareness about binge eating. And Dr. Kim, to go back to you, you touched on this a little bit, but can you maybe share with us, what do you think are some of the unique struggles that patients that have binge eating disorder are facing and maybe struggling with and having a difficulty even just coming forward with admitting what they're dealing with?
Well, I think probably the biggest unique challenge for people with binge eating disorder is the stigma associated with being a person of size in our culture. We hear people say, you know, we hear plenty of people without eating disorder say, oh, God, I wish I had anorexia. Or even some people say, I wish I could make myself throw up. I have never heard a single person say, God, I wish I had binge eating disorder and was overweight. So I think one of the biggest areas of struggle and biggest barriers for people to come forward for treatment is just the immense amount of shame and stigma associated with the physical effects of, for most people, engaging in this disease that is characterized by binge eating. Mm-hmm. We know there's a whole host of medical complications as well, but you know, the thing that really I think drives most people to treatment is the bullying that they receive from everyone and anyone they come into contact with, the discrimination, and just the shame that leaves them with, and the sense of isolation.
Right. And Jessica, if I can ask you kind of a piggyback question to Dr. Kim's, and that is just, what do you think are some of the common misconceptions that are associated with binge eating disorder that create so much stigma about this mental illness?
Well, the first thing, and this applies to all eating disorders of every kind, is that eating disorders belong with a certain group, whether it's a certain gender or whether it's a certain gender preference or orientation, whether it's a certain socioeconomic group. I think that is the biggest factor that causes any eating disorder to be underdiagnosed, is just, you know, not having an idea as a culture of the fact that eating disorders don't discriminate. And there was a study done in women of color going to their doctor, and they specifically asked these patients with binge eating disorder to say to their doctor, I think I have binge eating disorder. And every single woman was told by her doctor a different method for weight loss, but not one of them. And these were not women who came in and said, I have this vague symptom or that vague symptom, or I need to lose weight. These are all women who specifically said to their primary care doctor, I think I have binge eating disorder. And every single one was given weight loss advice. Not one of them was recommended treatment for an eating disorder. So I think that idea that the picture that individuals in our culture, that we all, you know, have in our mind of what someone with an eating disorder looks like, I think that's the number one thing that gets in our way.
You bring up really good points, and I think one of the big misconceptions about binge eating disorder, you know, it gets confused with, am I overindulging, or is it just a lack of control around food? But really there are specific criteria that define this disease. Dr. Dena, can you maybe share with us what some of those criteria are that would qualify someone with a diagnosis of binge eating disorder?
Sure. There is a misconception between overeating and the illness, related, or that we call binge eating disorder, because it is a mental illness. And I agree with, Jessica and Dr. Kim that, it has been underdiagnosed, but also the weight stigma that they could just do it if they had more willpower. They could lose weight if they tried hard enough, or everybody, you can look a certain way if you worked out or did this exercise. But with binge eating disorder, it is characterized as behavioral and emotional. And so with that, there's recurrent episodes of binge eating, feeling out of control. You have to meet certain criteria as far as duration, lack of control over eating, but what sometimes doesn't get really identified, I should say, is the underlying issue. So someone with binge eating has a lot of shame. They feel disgusted. They feel there's a lot of depression, co-occurring issues such as depression or anxiety. They feel embarrassed about eating with someone or eating in front of people. So these are things that differentiate people who maybe overindulge or overeat during Thanksgiving, which are kind of normal, than those with binge eating. They have these psychological issues related to shame, guilt, fear, pain, and disgust. And with that, they have extreme low self-esteem. And so those are really what characterizes someone who has binge eating disorder.
Thank you so much for explaining that. And as you said, Dr. Dena, that there's multiple issues and factors going on. There's the psychological issues, emotional and physical. So Dr. Kim, going back to you, can you maybe share with us what are some effective treatment methods for individuals who are struggling with binge eating disorder to kind of address all of those factors and issues that they may be dealing with?
Well, like Jessica said to begin with, doctors many times do more harm than good when a patient comes to them and says, I have binge eating disorder, because most physicians are not trained to treat people with eating disorders, and most physicians are very focused on obesity and weight loss. And the solution for somebody with binge eating disorder is not dieting behavior. That makes it worse. Part of the solution is having a good nutrition plan that enables them to have a variety of foods and to eventually be able to eat intuitively, and to have a therapist who really understands and has experience treating binge eating disorder and the underlying issues. Some of the evidence-based treatments for binge eating disorder include cognitive behavioral therapy. There's research looking at dialectical behavior therapy, interpersonal therapy. When we look at medications, there are certain medications that seem to be useful. But again, that's only a small piece of the pie, if you will, of treatment. So medications such as escitalopram or Lexapro has been shown to be beneficial. Topamax, many people are aware of, is another example. We know that Vyvanse has just been FDA approved for binge eating disorder. There's a lot of caution I would use with that particular medication because there's so much co-occurring substance use, and that is, as a stimulant, an addictive medication. Mm-hmm. But, if we don't get to the underlying issues that Dr. Dena, if we don't get to the underlying traumas, the underlying life experiences, the underlying effects on a person's spirituality, we're not going to help the person recover for the long haul.
Right, and I appreciate you sharing all that information because I think hopefully it gives people who are struggling with binge eating disorder a lot of hope that, there is effective treatment methods, and working with a treatment team that, touches each of those aspects and combines different forms of therapy can help them overcome it.
Absolutely.
So thank you for sharing that. And Jessica, going back to you, can you maybe just share with our viewers, what were some of the most recent revisions to the DSM in regards to binge eating disorder?
Well, the main thing that changed is that DSM-5 includes binge eating disorder as a diagnosis rather than as research criteria. And as research criteria in DSM-4, in the revision of DSM-4, the diagnosis that a doctor, clinician would give to an individual with binge eating disorder would be a diagnosis of eating disorder not otherwise specified. And so that category of eating disorder not otherwise specified that was really supposed to be a very, very small category for people who didn't meet criteria for anorexia and bulimia ended up being 66%, according to one study, of all patients in treatment for eating disorders. So only 33% of patients in treatment for eating disorders actually met the criteria for anorexia and bulimia. So now with the binge eating disorder being sort of pulled out of that research category and into its own diagnosis, I think the hope is that we actually give people a more specific explanation of what's going on with them, or more specific diagnosis to their issue, rather than being in a sort of a general category. The other main change to the binge eating disorder diagnosis is that it was given a severity rating. So the frequency and duration of the binge episodes that someone had to meet in the past to get that diagnosis, it's now decreased. So there's mild, moderate, severe, and extreme level, so a severity rating. But most importantly, to me, there's also a diagnosis of atypical binge eating disorder. So atypical to me is not quite the right wording. I mean, atypical to me means something like someone binge eats while standing on their head, or something that's genuinely unusual. But in the DSM, atypical means that someone's binge episodes either have been occurring less than once a week or have been occurring for less than 3 months. So atypical to me seems like not quite the right word, but nevertheless it's considered to be binge eating disorder of low frequency and or duration. And so what that does is it helps us include people in the diagnosis, instead of saying something which I find to be a little bit absurd, like, well, I know you have a binge eating problem and you experience shame and guilt and you eat alone due to embarrassment, but you don't technically have binge eating disorder because this has only been going on for 2 months and not 3 months. And so the changes really sort of expanded the definition, if you will, by expanding the diagnostic criteria. And so although the criteria themselves didn't change, the idea that there really is no specific number of times you have to experience a binge episode to warrant or deserve to get help, that to me is the biggest change and an improvement.
Definitely an improvement, and glad to see that happening, recently. And I think a lot of individuals who suffer may be afraid to come forward because they might not think that they're sick enough or, qualify, but it's good to see that those revisions have been made. We're going to kind of move into the treatment aspect of binge eating disorder, and I know that a lot of you have touched on some aspects of treatment already. And Dr. Kim, you mentioned that a wide variety of treatment is important, which includes nutrition therapy, pharmacotherapy, and possibly different forms of psychotherapy as well, to address the different issues that a person suffering with binge eating disorder may have. So Dr. Dena, as your experience as a psychologist, can you maybe explain the different forms of psychotherapy that might be effective for an individual who is dealing with binge eating disorder?
Sure. So relating back there, the psychotherapy could relate to some of the approaches that Dr. Kim mentioned, DBT or dialectical behavior therapy, cognitive behavioral therapy. But I feel that the most important thing, in the role of a counselor or psychologist or therapist or a nutrition counselor, nutritionist, dietitian, is really listening and validating someone who has an eating disorder, whether it's binge eating or anorexia or bulimia, or anyone with a mental illness. I think that's extremely important, is to listen and validate them, to tell them that they're not alone, that they do have a mental illness, and that their need for treatment is validated because of the different aspects: the need for structure, the need for skills, the need for support, the need to help them, deal with the underlying issues, whether it be trauma or, well, bullying could be trauma, but the low self-esteem, depression, anxiety, whatever it may be. So that is extremely important in psychotherapy, is the rapport that they build with the counselor or professional, and the validation. That's extremely helpful, because this may be the first time that they've been told that this is a real illness, rather than, if you just try harder or have better willpower, like we mentioned, it's always about blaming them, and this may be the first time that they've been told that this is a real illness and that you need help and can be helped.
Mm-hmm. Thank you so much for sharing that. Mm-hmm. And Dr. Kim, as a physician, you often see the medical side of things amongst other things. Can you maybe share what some of the medical concerns that an individual with binge eating disorder might have in their recovery, and how those are addressed?
Sure, absolutely. So some of the, not everybody with binge eating disorder is overweight. For patients who do have binge eating disorder and are overweight, many times they will have a diagnosis of high blood pressure, other forms of cardiac disease, diabetes. Type 2 diabetes is another very common medical problem. Sometimes it's the medical problems that actually give a person enough motivation and is a bit of a wake-up call for them to actually seek treatment for the underlying eating disorder. Another medical complication that we see frequently is arthritis, low back pain, knee pain, hip pain. Sometimes patients actually need hip replacements or knee replacements. So when we're treating people with binge eating disorder, it's important that we are connected to a primary care physician who can keep us posted on the status of their medical health. It's important, if we're recommending movement therapy or exercise as part of the treatment plan, that's done in coordination with somebody who can really be on top of the person's physical health, and whether or not it's safe for that person to be engaging in whatever level of exercise it is that we're recommending.
Right. Thank you so much for explaining that. And Jessica, if we can come back to you. So you are also a registered dietitian. Can you possibly explain, I'll ask you a couple questions, the role of a dietitian in the recovery process for an individual with binge eating disorder, as well as the medical nutrition therapy approach, and what does that involve?
Sure. So binge eating disorder is one of those things that I think dietitians as a profession, we have not necessarily been very good at educating our students on. I know there was nothing about it when I was in school, and unfortunately some of the things that are often recommended to dietitians to do with our patients are detrimental. In the case, as Dr. Kim said, dieting behavior is certainly not appropriate for someone with binge eating disorder. Neither is daily weighing. There are quite a lot of sort of weight loss methods, although I don't know that anyone has figured out weight loss. There's so many things that we don't know about weight and eating and hormones and brain chemistry and all different kinds of genes and a lot of the chemicals in the digestive system that influence hunger and appetite. But I think that as dietitians, not dietitians, the profession, I think, has a reputation for sort of wanting things to be about numbers, calories in, calories out. I think of that as more of like a bad Dr. Oz episode, but I think that dietitians sometimes get that same, painted with that same brush, even though we know that it's not just calories in, calories out. There's also all the hormonal regulation, and there's also all the brain chemistry modulation and all the things that influence eating and appetite and hunger and weight and metabolism. And so I think there's a sort of a new breed of dietitians, and it's not new, it's sort of more the eating disorder specialist dietitian that really takes a role as an advocate for a patient with binge eating disorder. So sort of a classic example is a patient that comes to see the dietitian because the doctor has said that, let's just say they need medicine for their hypertension. And the patient comes to the dietitian and says, my doctor says I have to go on medicine for my high blood pressure unless I can lose 60 pounds in the next 3 months. So I came to you so you can help me lose 60 pounds in the next 3 months. Well, that is not a realistic nor appropriate goal for most people. And a good quality dietitian will do her awesome, or his, motivational interviewing and a good thorough history and find out what's going on. And if that dietitian were able to identify, for example, that there's an issue with emotional eating, binge eating disorder, whatever that patient may be struggling with, then the dietitian then takes the lead in contacting the primary care physician and explaining to the patient and to the doctor that this patient may have an eating disorder, and so the weight loss is not only is it not going to happen in the next 3 months, but it's not even the number one priority. The number one priority is to manage the mental health and the eating behaviors of this patient, and it may not result in dramatic weight loss. And so would the doctor consider putting the patient on medication for high blood pressure now? And of course, would the patient consider taking the medication now, and then were the patient to lose the weight over time and no longer need the medication, then to trial not having the medication? So rather than putting the pressure on a patient to lose weight by a certain date, which actually can spur more binge eating, if the binge eating is a stress-related stress-triggered behavior, then the stress of trying to lose weight rapidly can actually cause weight gain. And so binge eating disorder becomes a little bit of a conundrum for dietitians, where we've so often been taught so many sort of, the patient runs the show. The patient comes to us with goals, and we help the patient reach their goals. In a lot of cases with binge eating disorder, and this is also true of the other eating disorders, well, specifically anorexia, when a patient comes to us and says their goal is something that we feel is actually not healthy for them, it feels different for a dietitian to say, I'm not sure that this is an appropriate goal. I think that something may be going on more than what this appears to be on the surface. But at the same time as it's a little bit of an unusual position from what we're used to, it's also an amazingly satisfying position to be able to tell someone, as you guys were both saying, this is a real thing. This is not just a lack of willpower. This is not just bad behavior. This is not just eating too many sweets. This is a real thing, and therefore there is some real help for it. So a lot of times I think the dietitian's role is really opening that door, because people will come to us and say, I just have a food problem, or I just need to eat less, or I know what to do, but I just don't do it. And so for us to be able to open that door and say, no, this is a real thing, this is a genuine issue, no, this hasn't been solved by any of your diets or diet programs that you've been to, there's more to this puzzle. I would say it's sad and unfortunate that a lot of people, I mean, they haven't been living in a cave. They've been getting regular medical care, but no one has necessarily identified it. So there's a sadness to that, to being the first person to identify it. But there's also some gratitude, I think, there on the dietitian's part to be able to say, no, I mean, I am a dietitian, but no, I'm not going to be this stereotype. I'm not going to weigh you every week, and I'm not going to, scold you if you haven't lost weight. That's not what this is about. And weight loss, it's not against the law to want to lose weight, but it's not acceptable as a goal. It's acceptable as a consequence of appropriate treatment. And that's what we sort of have that. It's a nice role to be able to help someone get into treatment, although a lot of times we have to be aware that sometimes we're kind of giving what might sound like bad news to patients, because they just feel like, why didn't anyone tell me this before? And that's a big bummer. But when we can be an advocate for a patient, when we can educate a patient, when we can educate a patient's family members, that's I think equally as important as actually educating people with nutrition knowledge. And I think a lot of dietitians do go into the field thinking, I'm going to tell people what to eat and how to eat and when to eat, and what we end up finding out once we get into the field is actually there's a lot more to it. And most people know, like, eat whole grains, eat fruits and vegetables. Like, this is not new information to people. There's so much more to it, and having a good background in mental health and in the different types of therapy and being able to recommend a counselor and recommend a psychiatrist, those are skills that dietitians, I think, dietitians of the 21st century have a lot more than probably in past decades.
Mm-hmm. And I just so appreciate hearing each of your perspectives. And I think it's interesting because a patient might come to see a dietitian or a physician for a symptom of binge eating disorder, you know, like Dr. Kim was saying, arthritis or cardiovascular issues, or coming to a dietitian saying I'm having issues with weight loss. And really those professionals can kind of be a gateway to helping that person identify the greater issue and hopefully connecting them to, you know, the multi-treatment that they might need to address it. And Dr. Dena, I know you kind of touched on this a little bit, but can you kind of share more about the role of the psychologist or the counselor in binge eating disorder treatment? Well, as like the final piece to the puzzle.
Okay. Sure. I think, you know, the role really, like I said, is to, you know, first of all, build a rapport, you know, listening and validating, but also helping them, guide them. You know, like Jessica and all of us have been saying, it's not about getting on a diet. It's about the consequence of good treatment, which is, you know, helping them with structure around meals, but also supporting them in the process, getting to the underlying issues. Helping them, I guess, develop goals that are unrelated to weight loss, but develop goals that are going to help them sustain and maintain in their recovery. It also is the role of the counselor is to help them build resiliency, you know, skills. We use a lot of the skills off of the dialectical behavior therapy that relate to emotion regulation, so dealing with and regulating their emotions, interpersonal effectiveness, so relationships, you know, we know that relationships are within eating disorders are stressed in many different ways, and also we work on mindfulness, so being present, being in the moment, not judging. That really helps with body image issues, and that's our goal, is to help them accept themselves. At the same time, we also work on the other aspect of distress tolerance, so dealing with stress. So all of those four modules are really wonderful with all eating disorders, but particularly, you know, binge eating disorder, in helping them learn skills, build resiliency, you know, help them with their self-esteem, but then also the realistic, practical methods of meals, consistency, and support. I really feel that's the role.
Mm-hmm. Thank you for sharing that, and thank you again, ladies, for just kind of explaining things from your perspective. And it's really neat to see how this really is a collaborative approach. You know, binge eating, I think, is about working together as professionals to help a person really overcome all of the different issues they might be struggling with. Dr. Kim, if we can go back to you, you mentioned that you've worked with several patients who not only are dealing with an eating disorder, but also with substance abuse. Can you maybe touch on some of the co-occurring disorders that you might see with someone that has binge eating disorder?
Absolutely. One of the most common is depression, major depressive disorder. Commonly co-occurs with binge eating disorder. Very, very commonly, a person with binge eating disorder may also have a substance use disorder. We see women coming in for treatment at Timberline Knolls for their addiction to, say, cocaine or alcohol, and then once they put the substance down, they experience a lot of symptoms of their eating disorder and have a lot of distress about it. So those two very commonly co-occur. It's one of the co-occurrences that I've spent a lot of time in my career treating, and I love treating that combination. I have yet, at the residential level of care, to treat a woman with binge eating disorder and a co-occurring disorder who does not have some form of trauma underneath all of it. So I think, as many of us have said, it's, if we're focused simply on the tip of the iceberg, which is the eating behaviors, we're really missing the boat if we're not looking at the underlying life experiences that led to this person who probably has some genetic susceptibility to it, to use food to get through life, because that's all that she knew, how to cope with her pain, how to cope with her life stressors.
Thank you for sharing that. And I think that's important too, that someone who might just only identify with the eating struggle, but really there may be a whole other issue going on. How would you recommend that a person, how does that even begin to be assessed when someone's initially presenting with just, the binge eating disorder?
Gently is probably the best answer. We really want to meet people where they are. We really want to, with motivational interviewing, what a person is motivated, where a person is motivated to start is perfectly fine and is enough. And most people have some sense that it's about more than just the food. Many times people are very obsessed with weight loss, and if I only looked better or if I only weighed less, then all of my other problems would go away. But most people have also had the experience of dieting and losing weight, and none of those other problems go away. So, there are a lot of life problems that people with binge eating disorder have, some of them stemming from the binge eating disorder, some of them around before the binge eating ever started for the person.
Thank you, Dr. Kim. Well, just in closing, ladies, I'd like to kind of ask each of you just what your encouragement might be to the person who may be watching this today, who is struggling with binge eating disorder and just unsure about how to get treatment, whether or not they should get help, or what would be your encouragement to that person? Starting with you, Jessica, if you mind sharing some closing thoughts.
Sure. My main encouragement is just to remind everyone that food is a mood-altering substance, and we often don't think about it that way, but it is. I mean, if you think about even just the last time you were, hangry and you hadn't had anything to eat in a while and you got kind of grumpy, and then you ate and you felt better. I mean, it's very practical, and so there's no shame in turning to food when you have a need for a mood-altering substance. It's just not congruent probably with the way that you want to live your life. So finding an eating disorder dietitian is an easy first step, because dietitians are very, very, very good at sifting, kind of like panning for gold, where you sift out the rocks, and just sifting and saying, well, this is about eating, and so perhaps this binge comes from waiting too many hours before eating, but this binge sounds like it's more about emotion regulation, or this binge sounds more about the bad things that happened to you at 7 p.m. when you were a kid. And so dietitians are really good at sifting what can be changed. I mean, that's one of our strengths, is we know what food can and cannot do. So, changing the way you eat can't necessarily change your past history, the sad things that have happened in your life. We know that. What you eat doesn't make you a clean or unclean person. We know that. So those are the kind of things that I think we would like to try to help you with. And if if you're looking for a dietitian who treats eating disorders, we'd love for you to go to the website ifedd.com. It's the International Federation of Eating Disorder Dietitians, and we have a treatment finder there where you can find an eating disorder dietitian in your area. And we also have dietitians who will work with you online if you're not in an area where there is a dietitian. So that would be my encouragement, is to say you're not a dumb person. If you made it through college, or if you're have a successful job, you're not a stupid person. You're not an unmotivated person. Seek help, because there's a reason why you're doing what you're doing with food, and it may be something that can be untangled fairly easily.
Thank you so much, Jessica. I appreciate you sharing that. And coming back to you, Dr. Dena, if you can share any closing thoughts or any resources or encouragement that you might have for the binge eating disorder sufferer.
Sure, it's my pleasure. I think one of the biggest messages I want to convey, that we probably are all want to convey, is that recovery is possible, that this illness is an illness, and that we in the field of eating disorders, including us on this panel, but even higher up in the conferences that we go to, there's research. There's a dedication to research and a commitment to learning more about this disorder so that we can treat it better. And so I just want to impart that we are all, in the field of eating disorder, we are really committed to understanding this disorder and wanting to treat it effectively. And with that, you're not alone. That recovery, it is possible. It can be done, but support, good, excellent quality treatment is necessary, because it is such a complicated disorder, as we've been talking about on this in this discussion today.
Right. Thank you. We appreciate hearing those thoughts from you.
Oh, can I mention one last thing? I'm sorry.
Sure. Yes, of course.
You had mentioned resource, and one of the resources is obviously Eating Disorder Hope, but I also wanted to put a resource for Binge Eating Disorder Association. That website has wonderful education material out there to help support those who are struggling with binge eating disorder.
Absolutely, and I appreciate you sharing that. That is a fantastic resource. And lastly, Dr. Kim, if you can just share your closing thoughts, any words of encouragement or resources that you might like to share for our viewers today.
Absolutely. I think, as others have said, the most important thing that people need to know is that I think all of us have treated and know many, many people who have freedom from binge eating disorder. So it is something that you can recover from. People hate themselves for not being able to control their food. Why can't I stop? Why can't I stop? And if you're sitting in somewhere watching this and hating on yourself because you can't stop, it's a symptom. This is that you can't stop because it's a symptom of a medical disease that you have. That's the bad news. The good news is that there is a solution and there is hope. And there are many good resources, as the other two panelists have shared. Eating Disorder Hope is great. In addition to what's already been shared, the NIDO website has some good information on binge eating disorder, as well as the ANAD website in addition to that.
Great. Thank you so much. Well, I'd just like to thank all three of you again for participating on our panel today in our discussion about binge eating disorder. Like I said, you three are just amazing people, and you have contributed so much to the eating disorder community. So we're so grateful for your time and just that you were able to share your expertise. And for our viewers today, we appreciate you joining us, and we hope that you have found some encouragement out of this conversation. Thankfully, our three panelists today have generously offered to contribute one of their books as a giveaway. So we have picked 3 random participants who RSVP'd for this event, and I will be contacting you each individually to let you know which book you have won today. So thank you, panelists, for sharing that generous offer, and thank you again, everyone, for participating. Feel free to check out eatingdisorderhope.com for our upcoming Google Hangouts and Twitter chats, and we hope to see you all soon. Have a great night, and thank you, everyone. Bye-bye.
Bye.